in color reflexology training, we have several maps, and those maps different from each other, and they are all working really, really well, as long as you are actually sticking to one particular map. So if you do an inverted man, which is a reflex zone created within Colourpuncture for Colourpuncture use, then you only use this concept. If you go with reflexology, then, for example, you translate from Foot Reflexology to Hand Reflexology, you only go with this map on the same day, within the same session. This is the point. On different days, on different sessions, you can absolutely try different versions. And some protocols are easier and more intuitive to translate to a particular system. So, for example, when we did spinal stroke, which is done in traditional Colourpuncture, is done on the spine, it was very logical the way it is done on a real body, because we're stroking the spine, we're stroking the bladder meridian, sacrum. It was much easier to translate it to inverted man and to translate it to the palms and then to the dorsal aspect. And then we actually added the nose, another microsystem. But the bottom line is it was much easier because in this way we could fully control our movements along the bladder meridian. Now imagine doing spinal stroke here on the ridge and then doing bladder meridian stroke. It's possible, but it will be difficult, more difficult. It will be more tiring to do on yourself, for example. It will be less precise. With this one is much more precise. Talking about prenatals and everything related to prenatals. Once again, Peter Mendel created prenatals and all related therapies based on original work called Metamorphosis by Robert St. John. And this is spin-off reflexology. So what we do in Metamorphosis, or later this technique was called metamorphic technique. So now you can see it as metamorphic technique. There was a French therapist who sort of adapted it a little bit more conceptually. And with the metamorphic technique, the premise is, unlike Colourpuncture, unlike prenatals, that if you don't treat the person, we create conditions for the vital energy of this person to support the person. So it's a different premise. Coming back to our topographies. So for prenatals, because this is based on a particular system, this is based on reflexology work by Robert St. John, it is more intuitive to actually translate it on the hands, even though this is not as straightforward in terms of just translation, because again, as we talked about already, the hand is shorter and wider usually than the foot. Having said that, we can still absolutely translate foot reflexology into hand reflexology. We are talking about most taxed joints of the body. So we're talking about C1, C7, T12, L5. But we're also looking at the thalamus point on the heel. Do you remember this life and death, or death and rebirth point? So this is the point at the heel. And this is also, if you look at your hand reflexology chart, this is the point for coccyx. This is why we use it for reference. When we did this treatment, which was extra treatment for karma, joy, action, and pre-existence, then we saw this point, which is point acupuncture point pericardium 7, as reference to the heel. And so this has to do with our thalamus point. This is the point with which we usually would finish our prenatal treatment of any kind. So this is my translation. Again, this translation does not follow reflexology map. It's not a hand reflexology map. It does not follow the inverted man principle. It follows like for like anatomically, just because from what I tried, this is the easiest way to do it. So anatomically, as you know, our feet and our hands have pretty much similar structure in terms of the bones. So we're using the bones as a reference and not any reflex zones, not any reflex zone from traditional reflexology, or not any Colourpuncture specific zones, such as topographies, such as inverted man. So point number 1 for C1 is going to be here. So I'm hoping you can see. So this is a joint. You can move it, and sometimes you can easily see the joint. I'm not sure if you can see mine here, but sometimes you can easily see the joint. Next one, if you look carefully, I think you can see it. Here, this is the top of one bone. This is the top of another bone. So this is kind of, the head of the bone. And in between, there is a joint, in between, there is a point. So this is your C7. This point is for thoracic 12. This point is for, it's basically L5S1, which is the relationship and fuzzy area, but let's go with L5, simplicity, in case you want to translate it further into vertebrae and stuff. And this is the last point, this is tip of the coccyx. So see how this translates. You can use this line, obviously, to stroke your prenatal line on feet as a spirit line, but you can use it for this particular page in reflexology training, which is about most taxed joint of the body. So I hope you can see it well, and this is a translation. This is a wonderful translation from feet to hands because you can do it on yourself. With this, you mark it up first. You then use massage it with your palpator. Really nice. You can massage it one way, then you can massage it another way. So you massage each point, and then you can use it. You can use your piezo if you want. You can use your piezo stimulation as well. So you're massaging it first one way, another way, or whichever way you like. And then you can proceed with the colors as you are massaging the points. And then as you are doing the color, I would like you to really take a nice deep breath, sit straight with your back straight. Ideally, this is something to be done at nighttime because you can also stroke prenatal lines. This is really, really good for sleep. So you can just sit in your bed, propped by the pillows, and it's really, really nice, really, really nurturing. And then you do the same, you translate on this other hand. And so this is your joints. So once again, apart from prenatal therapy, there are many, many different adaptations Peter Mendel did in terms of how we can access the vertebrae from reflexology projections, which we are doing here for most taxed joint, or how we can access the internal organs. And this is the main focus of his recent work with topography to translate how particular problem with a particular vertebra or particular level relates to internal organs, and how this obviously relates to our prenatal space. So it's a really, really beautiful system. This is absolutely topic for another time, but I would like you to know what is in development and what it developed from. Again, those are just most taxed joints, so this is a treatment. But in between this, obviously, if you want to find, for example, another thing, melancholy point, right? So, for example, you want to address mother, you want to address father. So the father is here. The mother zone, as you remember, it's C4, C5, middle of the neck. So we have our C1 here. We have our C7 here. So where is going to be mother? Mother is going to be here, right? So you can go for this as melancholy zone. You can get really, really creative with that.